Welcome, Mom. If you're 29 weeks pregnant, take a deep breath and know this. Your baby is growing beautifully, and you're doing an amazing job. In today's video, I'll calmly guide you through what's really happening inside your body at 29 weeks pregnant. Your baby's size, development and movements, breathing exercises, and the changes you may be feeling in your own body. We'll also talk about understanding your baby's what discomforts are normal, when to feel relaxed, and when to pay closer attention. All with calm, clear, and evidence-based information, made especially for new parents and expectant mothers. Before we begin, don't forget to like this video, subscribe to the channel, and activate the notification bell so you don't miss our weekly pregnancy update. And tell me in the comments, how many weeks pregnant are you? Let's go through this together. Week by week, you're not alone on this journey. At 29 weeks of pregnancy, your baby is experiencing one of the most remarkable periods of growth. Each day brings visible changes, not only in size, but also in strength, coordination, and internal development. For many parents, this rapid growth can feel both exciting and overwhelming, especially when trying to imagine what is happening inside the womb. Using visual tools, such as a 3D model that reflects the real measurements of a 29-week baby, can make this phase much easier to understand. Seeing a tangible representation helps transform abstract numbers into something real and comforting. It allows parents to better grasp how their baby fits inside the uterus and how much space they now occupy. Although the baby is shown stretched out in a model, it is important to remember that inside the womb, the baby remains in a curled fetal position. This natural posture allows the baby to fit comfortably, conserving space while continuing to grow safely and steadily. Understanding this difference between measurement and position brings peace of mind. It reassures parents that even though the baby is getting bigger, the womb is designed to adapt, stretch, and support this growth in a safe and harmonious way. Pregnancy often involves imagining something you cannot see, which can create anxiety for many new parents. Visualizing your baby through images or 3D models bridges this emotional gap, turning uncertainty into clarity and reassurance. When parents see the approximate size of their baby at 29 weeks, they often feel a deeper emotional connection. This visualization reinforces the idea that the baby is real, growing, and thriving, helping parents feel closer and more involved in the pregnancy. This emotional connection is not just sentimental, it plays an important role in maternal well-being. Feeling connected to the baby can reduce stress levels, promote relaxation, and strengthen the bond that continues to grow even before birth. By understanding your baby's physical presence, you replace fear with knowledge. This calm awareness helps parents trust the natural process of pregnancy and feel more confident about their body's ability to nurture life. At 29 weeks, measurements such as head-to-bottom length are used as standardized medical reference. These measurements help healthcare providers track healthy development while giving parents a reliable framework to understand growth. It is important to recognize that these measurements do not mean the baby is stretched out inside the womb. Instead, they offer a consistent way to compare growth across pregnancy, ensuring that development follows expected patterns. Seeing these measurements reflected in a physical model helps parents interpret medical information more easily. Numbers become relatable, transforming clinical data into something warm and human. This understanding helps parents feel informed rather than intimidated by medical terms. Knowledge becomes a source of reassurance rather than anxiety. As your baby grows at 29 weeks, your uterus continues to expand and adapt with incredible flexibility. This growth is gradual and intentional, designed to accommodate your baby safely and comfortably. The uterus is supported by muscles and ligaments that stretch over time, allowing room for your baby's size. This natural adaptation ensures protection while maintaining a stable environment inside the womb. Understanding this process helps parents trust their body's intelligence. Discomfort may arise, but it is often a sign that your body is adjusting exactly as it should. Recognizing this natural adaptation fear and encourages patience, reminding parents that growth and change are essential parts of pregnancy. Medical science provides precise information about fetal growth, but real-life visualization connects that science to everyday experience. Seeing a 3D model turns abstract knowledge into something tangible. This connection allows parents to better understand sensations such as pressure, movement, or stretching in the belly. What once felt confusing now makes sense when paired with visual understanding. By linking physical sensations to scientific explanation, parents feel more in control and less anxious. Knowledge becomes empowering rather than overwhelming. This blend of science and visualization creates a balanced, reassuring pregnancy. Confidence during pregnancy often comes from understanding what is normal. Visual tools help parents recognize that growth at 29 weeks follows a predictable, healthy pattern. Seeing how the baby fits inside the womb reassures parents that their body is capable and resilient. This confidence supports emotional well-being and reduces unnecessary worry. Understanding normal growth also helps parents communicate better with healthcare providers. Informed questions lead to clearer conversations and stronger trust. Confidence grows when parents feel informed, connected, and supported throughout pregnancy. Many parents describe a sense of awe when they visualize their baby's size at 29 weeks. This moment often strengthens emotional attachment and anticipation for birth. Seeing how developed the baby already is can bring feelings of gratitude and amazement. It reinforces the idea that life is progressing beautifully, step by step. This emotional impact encourages mindfulness and appreciation of the present moment in pregnancy. Instead of rushing toward birth, parents learn to value each stage. Emotional connection nurtures calmness, making the journey feel meaningful rather than stressful. Uncertainty is one of the biggest sources of anxiety during pregnancy. Visualizing your baby's size and position introduces predictability into the experience. Knowing what is happening inside your body allows parents to anticipate changes rather than fear them. Predictability fosters trust in the process. This trust reduces emotional tension and promotes relaxation, which benefits both mother and baby. Understanding replaces fear, turning pregnancy into a calmer and more confident experience. While models and measurements provide guidance, it is essential to remember that every baby develops at their own pace. Slight variations are normal and expected. Visual tools should be seen as reference, not rigid standard. They offer reassurance, not comparison. Recognizing individuality helps parents avoid unnecessary worry and embrace their baby's unique growth pattern. This perspective promotes acceptance and peace throughout pregnancy. At 29 weeks, pregnancy enters a phase of deep connection and awareness. Visualizing your baby supports emotional bonding and informed understanding. This stage invites parents to slow down, observe, and appreciate the incredible changes happening each day. By combining knowledge with emotional connection, parents feel grounded and reassured. Embracing this moment allows pregnancy to be experienced with calm, confidence, and love. At 29 weeks of pregnancy, your baby has reached a size that truly reflects how advanced this stage is. Measuring about 28 centimeters from head to bottom, your baby is no longer tiny. This is a strong, growing little human developing rapidly inside your womb. When we include the legs, the total length reaches approximately 38 centimeters. This measurement helps parents visualize just how much their baby has grown and how much space they now occupy within the uterus. These measurements follow official medical reference standards, which are used worldwide to assess healthy fetal development. Knowing this brings reassurance that your baby's growth is on track. Understanding size helps replace abstract numbers with meaningful awareness, allowing parents to feel more connected and confident during this phase. Medical professionals often use head-to-bottom length because it provides a consistent and reliable way to track growth. This method accounts for natural fetal positioning and avoids variations caused by leg movement. At 29 weeks, this standardized measurement offers a clear picture of developmental progress. It helps confirm that the baby's body proportions are developing harmoniously. Parents may worry that these numbers seem large, but it's important to remember that the baby remains curled inside the womb. The measurement does not represent how the baby lies internally. Understanding the purpose of these measurements brings calm and clarity, transforming medical data into reassurance rather than concern. Weighing approximately 1.25 kilograms at 29 weeks, your baby is gaining weight steadily and appropriately. This weight reflects healthy muscle, bone, and organ development. Weight gain at this stage supports temperature regulation, energy storage, and overall resilience. Each gram gained contributes to your baby's strength and readiness for life outside the womb. Medical reference values exist to ensure babies are growing safely, not to create pressure. Slight variations are completely normal and expected. Knowing your baby's weight helps parents trust that nourishment and oxygen are reaching the baby effectively through the placenta. Your baby's increasing size at 29 weeks directly supports organ maturity. As weight and length increase, organs like the lungs, liver, and brain continue refining their function. This growth allows the baby to practice essential skills, such as breathing movements and swallowing, inside the womb. These practices are vital for life after. The body's systems are becoming more coordinated. Supported by this steady growth pattern, size and function evolve together. Understanding this connection reassures parents that growth is not just physical, but deeply functional and purposeful. Seeing or imagining your baby's size at 29 weeks often brings a sense of amazement. Parents realize just how developed their baby already is. Visual references, such as models or images, help translate measurements into something tangible and comforting. This visualization strengthens emotional bonding. When parents understand size visually, fears about too big or too small often fade. Knowledge replaces uncertainty. This reassurance supports emotional calm and confidence throughout pregnancy. As your baby grows to this size, your body continues adapting beautifully. The uterus expands gradually to accommodate your baby's length and weight. Ligaments and muscles stretch intentionally, creating space while maintaining protection. This adaptation is a natural and healthy response. Although discomfort may appear, it often reflects normal physical adjustment rather than a problem. Trusting your body's ability to adapt helps reduce fear and promotes patience during this stage. While reference values provide guidance, every baby grows at their own pace. Genetics, maternal health, and placental function all influence growth. A baby slightly above or below average measurements can still be completely healthy. Variation is a natural part of pregnancy. Medical follow-ups focus on consistent growth trends rather than isolated numbers. Understanding this prevents unnecessary worry and encourages parents to embrace their baby's unique development. As your baby reaches this size, you may notice stronger movement, increased pressure, or changes in posture. These sensations are normal and expected. Your baby's length and weight contribute to shifts in your center of gravity, which may affect balance and comfort. Recognizing that these sensations reflect healthy growth can bring reassurance rather than concern. Awareness allows parents to respond with rest, gentle movement, and self-care. Regular prenatal appointments ensure that your baby's size and weight remain within healthy ranges. These checkups provide continuous reassurance. Healthcare providers use growth measurements to identify patterns, not perfection. Consistency matters more than exact numbers. This monitoring supports early intervention if needed, while offering peace of mind when development is normal. Trust in this process helps parents feel supported and secure. At 29 weeks, your baby's size and weight are signs of strength, resilience, and healthy development. This is a milestone worth celebrating. Each week brings your baby closer to birth, with growth serving as a foundation for life outside the womb. By understanding these measurements, parents can feel informed, calm, and connected. This knowledge transforms pregnancy into a journey of trust, awareness, and gratitude. At 29 weeks of pregnancy, one of the most reassuring milestones is knowing that all of your baby's organs are already full. This means the foundation of every vital system is in place and continuing to mature. While earlier weeks focus on formation, this stage emphasizes refinement and coordination. Each organ is learning how to function more efficiently within the protected environment of the womb. For many parents, this knowledge brings immense peace. It confirms that the most critical developmental steps have already been achieved. Understanding this milestone helps reduce fear and replaces it with confidence in your baby's progress. Although the organs are formed, they continue improving their performance every day. This gradual maturation is essential for life outside the womb. Systems such as digestion, circulation, and neurological responses are becoming more synchronized. Your baby is practicing skills they will need after birth. This process happens quietly and naturally, without you needing to do anything special beyond caring for yourself. Knowing that your baby is practicing and preparing brings reassurance and emotional comfort. The lungs are one of the last organs to fully mature, and at 29 weeks, they are making remarkable progress. This stage is critical for strengthening lung tissue. Your baby is producing surfactant, a substance that helps keep the air sacs open after birth. This greatly improves breathing ability. Even though your baby is not breathing air yet, the lungs are actively preparing for that moment. This development is a powerful sign of readiness and resilience. At this stage, your baby spends about 10 to 20% of the time practicing breathing. These are gentle, rhythmic motions of the chest and diaphragm. Although no air enters the lung, these movements train the muscles needed for breathing after birth. This practice strengthens coordination between the brain and respiratory system. Knowing your baby is rehearsing such an essential function often brings deep reassurance to parents. Breathing practice helps your baby transition smoothly after birth. It prepares the lungs, muscles, and nervous system to work together. This preparation reduces respiratory stress when your baby takes their first breath. Each practice movement builds confidence within your baby's developing body. This invisible work happening daily inside the womb is a powerful sign of healthy development. While your baby practices breathing, the placenta continues delivering oxygen and nutrients. It remains the baby's lifeline. The placenta ensures your baby receives everything needed to support organ maturation. This partnership between placenta and baby is essential for continued healthy development. Trusting this natural system brings calm and confidence to expecting parents. Knowing that organs are formed and functioning helps parents feel safer and more grounded. Fear of the unknown often decreases at this stage. This knowledge allows parents to focus on bonding and preparation rather than worry. Understanding development empowers parents with calm awareness. Peace of mind supports emotional health for both mother and baby. Even though organs are formed, development continues at an individual pace. No two babies mature exactly the same way. Minor differences in timing are completely normal and expected. Healthcare providers monitor progress to ensure steady improvement rather than perfection. Recognizing normal variation helps parents avoid unnecessary anxiety. The shift from formation to function marks a turning point in pregnancy. Your baby is no longer just developing structures, but actively using them. This stage represents strength, preparation, and growing independence. Parents often feel a deeper sense of connection knowing their baby is practicing life skills. This awareness transforms pregnancy into a moment of awe and appreciation. At 29 weeks, your baby is doing exactly what they need to do. Organs are formed, systems are maturing, and breathing practice is underway. Your role now is to rest, nourish yourself, and trust this natural process. Confidence grows when knowledge replaces fear. This stage invites calm, patience, and trust in the journey ahead. At 29 weeks of pregnancy, your baby's eyes are no longer sealed shut. The eyelids can now gently open and close, marking an important milestone in sensory development. Although the womb remains dark, this ability shows that the eye structures and muscles are working together. It is a sign of growing neurological coordination. This development reassures parents that the baby's nervous system is maturing as expected. Knowing this brings comfort and a sense of wonder about how much your baby is already capable of. One of the sweetest details at this stage is the appearance of eyelashes. These fine hairs are a visible sign of physical maturity. Eyelashes serve a protective function after birth, but during pregnancy, they reflect healthy skin and hair development. This small detail often creates a strong emotional response for parents, making the baby feel more real and present. Such visible markers help parents feel closer and more emotionally connected to their baby. At 29 weeks, your baby's movements often feel stronger, more defined, and more frequent. Rolls, stretches, and kicks become easier to recognize. These movements indicate healthy muscle tone and proper neurological signaling between the brain and body. Feeling these movements reassures parents that the baby is active and responsive. Movement becomes a daily source of comfort and connection during this stage. Each movement your baby makes reflects communication between nerves, muscles, and the brain. This coordination is a key sign of healthy neurological development. As the baby grows stronger, movements may feel more purposeful and rhythmic. These patterns help healthcare providers assess fetal well-being. For parents, movements serve as a reassuring sign that everything is progressing normally. Although vision is still limited, your baby's sensory awareness is expanding rapidly. Touch, pressure, and sound are becoming more meaningful. Your baby may respond to external sounds or changes in position with movement. This sensory engagement shows that the nervous system is actively processing information. Understanding this brings reassurance that development is advancing on multiple levels. As movements become clearer and features more defined, many parents report feeling a deeper bond at this stage. The baby's responses create a sense of interaction, even before birth. This emotional connection supports maternal well-being and reduces anxiety. Feeling connected fosters calm and confidence throughout pregnancy. It's important to remember that every baby has unique movement patterns. Some are more active at certain times of day. Periods of rest are normal and healthy. Healthcare guidance focuses on consistent movement over time rather than constant activity. Recognizing normal variation helps parents remain calm and observant without unnecessary worry. Behind every visible movement is rapid neurological growth. Neural connections are forming and strengthening daily. These connections support coordination, reflexes, and future learning. Although unseen, this development is crucial for long-term health. Trusting this unseen progress brings peace of mind. Seeing signs of physical maturity, such as eyelashes and coordinated movements, helps parents feel reassured. These milestones indicate that the baby is becoming stronger and more prepared for life outside the womb. Confidence grows as understanding replaces uncertainty. This stage encourages parents to trust both their baby and their body. At 29 weeks, these visible and tangible changes mark a beautiful milestone in pregnancy. Each movement, blink, and stretch is a reminder of your baby's growth and resilience. This awareness invites calm appreciation of the journey. Embracing these moments helps parents feel grounded, hopeful, and connected. At 29 weeks of pregnancy, your baby enters an important transition phase. This is when many babies begin preparing for the head-down position that will be used for birth. Although the baby may not turn completely at this stage, internal adjustments are already happening. These movements help the baby explore space and orientation inside the uterus. This process is gradual and natural, not sudden. There is no need to feel anxious if your baby has not turned yet. Understanding this transition helps parents feel calm and informed rather than worried. Preparing for a head-down position does not mean the baby is already fixed in place. It simply means the baby is becoming more aware of gravity and space. The uterus provides room for gentle repositioning. Your baby moves, stretches, and shifts naturally. These movements help strengthen muscles and coordination. Knowing this reassures parents that preparation happens step by step. As your baby grows and prepares for birth positioning, monitoring movements becomes especially valuable. Fetal movements reflect muscle strength, neurological health, and oxygen delivery. Paying attention to these movements helps parents feel connected and reassured. Movement awareness becomes a simple and powerful way to check on your baby's well-being. Kick counting is a method recommended by healthcare providers to monitor fetal health. It is easy, safe, and effective. The term kick includes any movement such as rolls, stretches, or gentle taps. This method does not require special equipment, only calm attention. Understanding kick counting empowers parents with confidence and awareness. Kick counting should be done in a quiet, relaxed environment. Lying on your side often helps you feel movements more clearly. In 1 hour, feeling at least 3 movements is generally reassuring. In 2 hours, around 10 movements is considered typical. This practice is meant to reduce anxiety, not create stress. Babies tend to have sleep and wake cycle, just like newborn. Choosing the same time each day helps with consistency. Some babies are more active after meals or during evening hours. If movements feel quieter, gentle stimuli, such as resting or eating, can help awaken the baby. Consistency allows parents to notice patterns and feel more secure. Occasional quiet periods are normal, but a noticeable decrease in movement should not be ignored. Reduced movement may signal that the baby needs evaluation. Healthcare providers encourage parents to trust their instincts and seek guidance if something feels different. Prompt attention supports safety and peace of mind. Kick counting helps transform anxiety into calm awareness. Instead of guessing, parents can observe. This practice creates a sense of participation in the baby's care. Feeling movements reassures parents that the baby is active and well. This emotional reassurance strengthens confidence throughout pregnancy. As your baby prepares for birth positioning, trust becomes essential. Your body and baby are working together naturally. Movements are signs of adaptation, not discomfort. Trust reduces fear and encourages patience during this. Confidence grows when knowledge and observation align. This stage of preparation is an important milestone. Your baby is learning where to go and how to get ready for birth. By observing movements and practicing kick counting, you stay informed and reassured. This awareness supports both emotional and physical well-being. Embracing this phase helps parents feel calm, prepared, and connected. Kick counting exists to give parents a simple, reliable way to monitor their baby's well-being at home. It transforms intuition into gentle observation. Instead of guessing whether the baby is okay, parents can use movements as a reassuring signal of health. This method is widely recommended because it is safe, non-invasive, and accessible to every pregnant woman. Understanding its purpose helps parents feel empowered rather than anxious. The word kick can be misleading because any movement rolls, stretches, taps, nudges, or even subtle flutters are all valid. Babies use elbows, knees, feet, and even their whole body to move inside the womb. Recognizing different types of movement prevents unnecessary worry. This awareness helps parents feel confident in what they are feeling. In a calm and quiet setting, feeling at least 3 movements within 1 hour is generally reassuring. This guideline reflects normal fetal activity patterns at this stage of pregnancy. Some babies may move much more than this, which is also normal. The goal is reassurance, not perfection. If movements feel slower, extending observation to 2 hours is recommended. Within this time, around 10 movements is common. Babies may take breaks, which is completely normal. Extending the time frame allows for natural cycles to occur. This approach reduces unnecessary panic and promotes calm observation. Babies often have predictable active periods. Many are more active in the evening or afternoon. Choosing the same time each day helps identify your baby's normal rhythm. Consistency allows parents to notice changes more easily. Routine brings reassurance and emotional stability. Kick counting works best in a relaxed environment. Lying on your side improves blood flow and sensation. Reducing distractions helps you tune into subtle movement. Calm breathing and stillness enhance awareness. This practice becomes a moment of connection rather than stress. If movements feel quiet, gentle stimulation may help. Resting, eating a small snack, or changing position can awaken the baby. Some healthcare providers suggest a small piece of chocolate, used mindfully and occasionally. These techniques are meant to observe response, not force movement. Responsiveness itself is reassuring. If you do not feel expected movements after proper observation, it is important to contact your healthcare provider. Reduced movement can sometimes signal that the baby needs evaluation. Healthcare teams prefer reassurance checks over delayed care. Seeking help early supports safety and peace of mind. Kick counting reduces anxiety by replacing fear with observation. It helps parents feel involved and connected to their baby's care. This daily check-in builds confidence and trust. Emotional calm benefits both mother and baby. Over time, kick counting helps parents learn their baby's unique patterns. This familiarity builds deep trust and reassurance. Instead of focusing on numbers, parents focus on connection. This practice transforms monitoring into bonding. At 29 weeks of pregnancy, many women begin to notice new or intensified physical discomfort. Back pain, hip pain, and pelvic instability are among the most common sensations. These discomforts can feel alarming at first, especially when movements in bed or walking cause sharp or pulling sounds. Understanding that these feelings are common helps reduce fear. Discomfort does not mean something is wrong. it often means your body is adapting. Relaxin is a hormone released throughout pregnancy with stronger effects as birth approaches. Its purpose is to loosen ligaments and joints, especially in the pelvic area, to allow space for childbirth. This loosening affects not only the pelvis, but also the hips, lower back, and surrounding joints. Knowing the role of relaxin helps explain why the body may feel unstable or sore. As relaxin softens ligaments, the pelvic joints gain flexibility. This flexibility is necessary, but can feel uncomfortable. Movements such as turning in bed, standing up, or climbing stairs may trigger sharp sensations. These sensations reflect joint mobility rather than injury. Understanding this helps parents respond with patience rather than fear. As the baby grows, your center of gravity shifts forward. This change alters posture and muscle engagement. The lower back works harder to support this shift, often leading to muscle fatigue. Hips and pelvis bear more weight, increasing strain on joint. These changes are temporary and purposeful. Pain related to relaxin often appears suddenly because joints move more freely. Small movements can trigger discomfort when ligaments are loose. This does not indicate damage, but increased mobility. Moving slowly and mindfully can help reduce discomfort. Turning from one side to another in bed often becomes uncomfortable. The pelvis may feel sore or unstable during these. Using pillows between the knees or under the belly can help. Simple adjustments improve comfort and rest quality. Physical discomfort can affect emotional well-being, especially when sleep is disrupted. Understanding the cause of pain helps reduce frustration and anxiety. Reassurance supports emotional resilience during pregnancy. Knowledge transforms discomfort into manageable awareness. Gentle stretching, proper posture, and supportive footwear can help reduce. Listening to your body and resting when needed is essential. Avoid sudden movements and heavy lifting. Self-care supports both comfort and confidence. Persistent aches that worsen with movement but improve with rest are often normal. However, pain accompanied by fever, numbness, or severe swelling should be discussed with a healthcare provider. Most discomforts at this stage reflect adaptation rather than pathology. Understanding this balance promotes calm decision-making. At 29 weeks, your body is actively preparing for birth. Every adjustment serves a purpose. Discomfort is a sign of readiness, not weakness. Trusting this process helps parents feel grounded and supported. This stage invites patience, care, and self-compassion. At 29 weeks of pregnancy, many women notice a sudden increase on the scale. This change can feel concerning, especially when it seems to happen quickly. However, much of this weight gain is not fat. It is commonly related to fluid retention, which is a normal physiological response during pregnancy. The body holds extra fluid to support blood volume, placenta function, and fetal development. Understanding this helps replace worry with reassurance. As the uterus grows, it places pressure on surrounding organs, including the kidney. This pressure can temporarily reduce the kidney's ability to eliminate excess fluid efficiently. Hormonal changes also contribute to fluid retention, especially in the third trimester. This retained fluid often shows up as swelling in the legs, feet, hands, or face. Recognizing the cause helps parents feel calmer about these visible changes. Fluid retention differs from fat accumulation. It does not reflect poor nutrition or unhealthy habits. After birth, when pressure on the kidneys decreases, the body naturally releases this excess fluid. Many women notice rapid weight loss in the days and weeks following delivery. For this reason, knowing this can greatly reduce anxiety about long-term weight change. Fluid often accumulates in the lower extremities due to gravity, especially in the legs and ankle. Long periods of standing or sitting can increase swelling. This swelling may fluctuate throughout the day and improve with rest. Understanding these patterns helps parents feel more in control. During pregnancy, blood volume increases significantly to support both mother and baby. This expansion requires additional fluid, contributing to overall weight gain. This process ensures adequate oxygen and nutrient delivery to the baby. Blood volume expansion is a protective and necessary adaptation. Swelling may cause tightness, discomfort, or reduced mobility. These sensations are common and often worsen later in the day. Elevating the legs and resting on the side can help reduce discomfort. Gentle movement and hydration support circulation. Mild to moderate swelling is common at this stage of pregnancy. It usually improves with rest and position. Sudden or severe swelling, especially in the face or hand, should be discussed with a healthcare provider. Knowing the difference helps parents stay calm yet attentive. Rapid physical changes can affect self-image and emotion. Understanding the physiological reasons behind these changes promotes self-compassion. Pregnancy weight gain serves a purpose and is temporary. Reassurance supports emotional well-being during this phase. Staying hydrated helps the kidneys function more effectively. Balanced nutrition supports circulation and overall comfort. Rest and gentle activity improve fluid movement in the body. Small habits can make a meaningful difference. After birth, the body gradually releases retained fluid. This natural process helps restore balance without intervention. Trusting this transition reduces unnecessary worry. Understanding fluid retention allows parents to approach this stage with patience and calm. At 29 weeks of pregnancy, nutrition plays a crucial role in supporting both maternal comfort and fetal development. Your body is working harder than ever, supplying nutrients to a growing baby while maintaining your own health. A balanced diet helps prevent common discomforts of the third trimester. Understanding nutrition at this stage brings confidence and reassurance. Fiber helps keep the digestive system moving smoothly, which is especially important as the uterus presses on the intestine. Constipation is common at this, and fiber helps reduce discomfort and straining. Whole grains, fruits, vegetables, and legumes are excellent fiber sources. Adequate fiber supports comfort and overall well-being. Iron is essential for producing hemoglobin, which carries oxygen in the blood. During pregnancy, iron needs increased significantly. Adequate iron supports both maternal energy levels and fetal oxygen supply. Understanding this helps parents prioritize iron-rich foods. Iron-rich foods can sometimes contribute to constipation. Combining iron intake with fiber-rich food helps maintain digestive balance. This combination reduces discomfort and supports nutrient absorption. Balanced choices promote both comfort and nourishment. Water plays a vital role in digestion, circulation, and fluid balance. Adequate hydration helps soften stools and reduce swelling. Drinking water throughout the day supports kidney function. Hydration enhances overall comfort during pregnancy. At 29 weeks, managing sugar intake helps reduce the risk of gestational diabetes. Frequent, balanced meals help stabilize blood sugar levels. Limiting excessive sweets supports maternal and fetal health. Mindful nutrition supports long-term well-being. Foods such as beans, lentils, leafy green vegetables, and lean meats are excellent iron sources. Combining iron with vitamin-rich foods improves absorption. Simple dietary strategies enhance nutrient effectiveness. Informed choices support healthy pregnancy outcomes. Proper nutrition ensures that nutrients reach the baby through the placenta. This supports organ maturation, weight gain, and overall development. Nutrition acts as a foundation for lifelong health. Understanding this strengthens motivation for balanced, stable blood sugar, and adequate nutrients support emotional balance. Fatigue and irritability can worsen when nutrition is inadequate. Balanced meals promote steady energy and mood. Emotional well-being benefits both mother and baby. Rather than perfection, consistency is key. Listening to your body helps guide food choices. Nutrition at this stage supports both pregnancy and postpartum recovery. Confidence grows when nourishment is intentional and informed. At 29 weeks of pregnancy, information becomes one of the greatest sources of protection. Understanding warning signs does not create fear. It creates preparedness. Knowing what is normal and what requires attention helps parents feel more in. This awareness allows timely medical care when needed. Preparedness replaces panic with confidence. Placenta previa occurs when the placenta covers or reaches the cervix. This condition can interfere with vaginal birth and may cause painless, bright red bleeding. It is usually diagnosed through ultrasound. Early diagnosis allows careful monitoring and planning for a safe delivery. Placental abruption happens when the placenta partially or completely detaches from the uterus before birth. This can reduce oxygen and nutrient supply to the baby. Symptoms may include abdominal pain, back pain, contractions, and bleeding. Prompt medical care is essential to protect both mother and baby. Thrombophilia is a condition where the blood becomes more prone to clotting. In pregnancy, this can affect blood flow to the placenta. Reduced blood flow may limit oxygen and nutrients reaching the baby. Early recognition and medical care greatly improve outcome. Symptoms may include leg pain, swelling, color change, or localized warmth. Reduced fetal movement can also be a sign of impaired placental circulation. Any sudden or unusual symptoms should be reported. Seeking care early prevents complications. Some women notice yellowish stains on their bra during the third trimester. This fluid is colostrum, the first form of breast milk. Colostrum is rich in nutrients and antibodies. Its presence usually indicates normal breast preparation for breastfeeding. As the uterus grows, it pushes against the diaphragm and lungs. This can cause shortness of breath or a feeling of limited airflow. Mild breathlessness is common, but sudden or severe symptoms need evaluation. Women with asthma should discuss symptoms with their healthcare provider. A noticeable decrease in fetal movement should never be ignored. Movements reflect oxygenation and neurological health. Kick counting helps identify changes early. Prompt evaluation ensures safety and reassurance. Any bleeding, intense pain, fever, sudden swelling, or reduced movement requires attention. Healthcare providers prefer early contact over delayed care. Trusting your instincts is essential. Seeking help is an act of protection, not overreaction. Understanding warning signs empowers pregnant women to act confident. Knowledge transforms fear into awareness. This empowerment supports a safer, calmer pregnancy. With information and support, parents can move forward with trust and peace.